Hello everybody, Roberto Parker here with Innovative Sports Training. Welcome to another Health Detective Talk. Can I prevent knee injuries? The answer is no. Anytime you get hit in a very traumatic way that your body can't handle, you will become injured. I don't care how strong you are. The better question is this: can I reduce my susceptibility to knee injuries? The answer is definitely yes. If you fall out of a ladder, off of your roof, you get hit in a football game, direct trauma on the knee, something's going to give there. Something's going to give. However, the stronger you are, the less susceptible to injuries you are. Now, there's four components to the knee. There's the ACL, which is your anterior cruciate ligament. The PCL, which is your posterior cruciate ligament. Your MCL, your medial collateral ligament. And the the LCL, which is your lateral collateral ligament. Those four form a web, so to speak, a very strong web, so the knee doesn't rotate and overbend and overextend too much. So the stronger you are, the less this kind of stuff's going on. I'm pronating my knee in and out. I'm kind of exaggerating. That's pronation. That's supination. You want to be lined up perfectly. That's why posture is so important. Posture should be knees over toes, hips over knees, shoulders over the hips. So the more you're like this, or the more you're like this, hyperextension, you're going to be more susceptible to some sort of injury, possibly even your back. Now, how do we get the body where you're less susceptible to knee injuries? Midsection, you've got to get it stronger. And I'm just not talking about doing a ton of sit-ups. There's a much better way of going instead of doing a bunch of sit-ups. You've got to get the midsection stronger. You've got to get the posterior chain stronger from your neck all the way down to your heels of your foot. Get the posterior chain stronger. You've got to get the buttocks stronger, which is part of the posterior chain. That really helps because that will keep the knees lined up. You've got to improve your mobility and stability of your hips. I work with so many young athletes and people that are older that are so tight in their hips, it's like concrete in there. It's unbelievable. And those same individuals typically have back issues and oftentimes knee issues because they're so dang tight in their hips. They can barely even do a squat or bend their knee. When they do crawling exercises, because we do a lot of bear crawls here and Spider-Man crawls, they can't hardly do them because they're so dang tight in their hips. And that's why their backs and their knees are hurting. And those people are much more susceptible to knee injury. But you feed all that into good posture once again. You've got to work on your posture. Now, it's hard just to walk around like this all day long, I realize that. So, how do you improve your posture? Once again, you get your midsection stronger, you get your posterior chain stronger, you get your hip mobilization improved, and hip stabilization improved, and that will help to improve your posture. That will take the load off of the knee. Okay? So when you're cutting and changing directions and jumping, now you won't have as much twisting and turning and bending going on. You're going to be much more stable. I'm going to show you one exercise here, and there are tons of exercises that I can do for hip mobility, stability, for midsection strength, for posterior chain strength, and basically just for improving your posture. But this is just one. I do this a lot in my training practice here. I'm going to stand on this air pad. Now my right foot is stabilizing my body. Just doing this, my right hip is working considerably, just standing like this. Now I'm going to move my leg up and down like this. So I'm working on mobility and stability. Now, I might have a person do that 30 seconds, maybe 60 seconds per side. That's just one exercise, guys. Make an appointment with me and I'll be more than happy to show you more like that. I hope this video has informed you guys. Once again, can you really prevent knee injuries? I lean towards No, it depends on the stress of whatever you're doing. If you take a real direct hit on your leg, something's going to give. If you fall off of a ladder, something's going to give. You fall off a roof, something's going to give. Okay, you land hard on your knee, something's going to give. But you can reduce the susceptibility to injury and also reduce the severity of a knee injury if you do become injured by getting your midsection stronger, your posterior chain stronger, improving your hip mobility, hip stability. That will improve your posture. That will improve your knee strength. So I don't look directly at the knees themselves. I look at what's going on around the knee, with your hips, with your ankles, with your feet. And typically even with your feet now, if your feet are hurting you, even with plantar fasciitis, it's probably because of something going on up here in your hips, in your back, in your butt, in your midsection. So keep that in mind. Guys, I'm not going to make this a real long video. I've talked long enough. Call me, set up an appointment. I'll be more than happy to work with you, your athletic team, your son or your daughter if they're an athlete. If you're a non-competitive athlete, you're having some back issues, some knee issues, I'll be more than happy to set up a time with you and we'll do a 30-minute free consultation and see if it's a good fit. Take care, guys. Oh, before I forget, my number is 816-405-7703. My email is rwpsports@yahoo.com. Take care. God bless. Bye-bye.